Look closely at this scene. For you, it is a nightmare. For a woman in the year 1300, it was just Tuesday. She is not in a hospital. She is lying in a nest of infection, straw soaked with animal waste, rodent urine, and the fluids of labor. What you see crawling around her body is not a metaphor for death. It is the biological reality of a world where life was born in the same filth where rats bred and died. Today I am going to show you why giving birth was, in fact, a death sentence. I am vain, and this is the crime scene they never taught you in history class. Why straw? That is the question no one asks when they romanticize medieval life. The answer is simple and horrifying, because there was nothing else. In the year 1300, the floors of most homes were compacted dirt or cold stone. Beds were a luxury reserved for the wealthy. For the majority of women, the birthing bed was a pile of straw spread across the floor. The same straw used to feed livestock, the same straw where chickens nested, the same straw that soaked up urine, feces, and the fluids of life and death for months at a time. It was not changed frequently. It was not cleaned. It was simply added to, layer upon layer, until the bottom became a compacted mat of organic decay. And this is where a woman in labor was expected to lie for hours and sometimes days. The straw was damp. Always damp. Moisture from the ground below seeped upward, mixing with whatever had been spilled or excreted on top. This created the perfect environment for bacterial growth. Modern microbiological studies of recreated medieval living conditions have confirmed that damp straw harbors concentrations of E. coli, streptococcus, and staphylococcus aureus at levels that would be classified as biohazardous today. But in 1300, it was just called home. The heat made it worse. During labor, a woman's core body temperature rises. Her skin flushes. She sweats. And that heat radiates into the straw beneath her, creating a warm, moist microclimate, the biological equivalent of an incubator. Insects are drawn to warmth. Fleas, lice, mites, they migrate toward the source of heat like it is a beacon. Rats do the same. Medieval homes were infested with rodents as a baseline condition. Food was stored in open barrels. Waste was thrown into corners or out windows. Rats lived in the walls, in the thatch roofs, and yes, in the straw. And when a woman lay there, vulnerable, bleeding, her body producing the scent of blood and amniotic fluid, the rats came closer. This is not speculation, this is documented. The medieval physician Bernard of Gordon, writing in the early 1300s, recorded cases of women being bitten by rats during childbirth. He did not find this unusual. He simply noted it as one of many complications. The bite itself was dangerous. Rat saliva carries Streptobacillus moniliformis, the bacterium responsible for rat bite fever. But the psychological trauma of being bitten while in labor, unable to move, unable to defend yourself, is something we cannot measure. The woman in that straw was not just fighting to bring life into the world. She was fighting to stay alive in an environment designed to kill her. But the straw was only the beginning, because once the child was born, the real contamination began. Within 48 hours of giving birth, the fever started. It always started the same way. A chill that made her teeth chatter despite the fire burning in the hearth. Then came the heat. Not the warmth of exertion, but a furnace burning from the inside out. Her pulse raced. Her skin became slick with sweat that smelled wrong. Sweet, faintly metallic, like meat beginning to spoil. Medieval texts called it childbed fever. The church called it God's punishment for Eve's sin. We call it puerperal sepsis. And it was a death sentence. The infection began the moment the midwife's hands entered the birth canal. Those hands had been everywhere. Minutes before attending the birth, she might have been gutting a fish, milking a cow, or clearing waste from the animals. There was no concept of hand washing. Soap existed, but it was expensive and used sparingly, primarily for laundry, not skin. The idea that invisible organisms on the hands could cause disease would not be proposed until the 1840s, when Dr. Ignaz Semmelweis observed that doctors who performed autopsies and then delivered babies without washing their hands caused mortality rates to skyrocket. In 1300, no one made that connection. The midwife's hands were tools, and those tools were contaminated. When the cervix dilates and the placenta detaches, it leaves an open wound inside the uterus, a raw, bleeding surface roughly the size of a dinner plate. This is normal, this is biology, but it is also an entry point. Every bacterium on the midwife's hands, under her nails, embedded in the cloth she used to wipe the blood, all of it was introduced directly into the woman's bloodstream. Streptococcus pyogenes was the most common culprit. This bacterium thrives in the warm, oxygen-poor environment of damaged tissue. It produces toxins that destroy red blood cells and trigger massive systemic inflammation. The body tries to fight it. White blood cells flood the infection site, but the bacteria multiply faster than the immune system can respond. By the third day, the woman could no longer stand. Her abdomen swelled and became rigid to the touch. The pain was constant, a deep tearing ache that radiated from her pelvis into her lower back. Her uterus, still contracting as it tried to return to its normal size, was now filled with pus. The discharge that came from her body was foul, thick, yellow-green, and reeking of decay. This was not menstrual blood. This was necrotic tissue liquefying and draining. She was rotting from the inside while still alive. And there was no treatment, no antibiotics, no surgical intervention, just prayer and waiting to see if her body could outlast the infection. Most could not. But for those who survived the fever, another battle was just beginning, because staying alive meant staying clean. And in the 1300s, that was nearly impossible. After the birth, the bleeding did not stop. For weeks, sometimes months, a woman's body expelled blood, tissue, and fluid as the uterus slowly healed. This is called lochia, and it is a normal part of postpartum recovery. But in the 1300s, managing that bleeding was a biological disaster. There were no disposable pads, no sanitary products, just cloth, linen rags to be specific, torn from old tunics, bed sheets, or whatever fabric could be spared. These rags were folded, placed between the legs, and held in place by undergarments or simply tucked into the waistband of a skirt. And then they were reused, over and over. The same rags that absorbed menstrual blood 1 month were washed, if you can call it that, and used again the next. The washing process was crude. Water was hauled from a well or a river, poured into a wooden bucket, and left sitting for hours or days before use. That water was stagnant. It was not boiled. It was not treated. Any bacteria present in the water was transferred directly onto the cloth. The rags were scrubbed with cold water and maybe a small amount of lye soap if the family could afford it. Then they were hung to dry, often indoors, where they absorbed the smoke from the cooking fire and the ambient moisture of the home. They were rarely fully dry before being used again. The result was a cloth saturated with bacteria, Staphylococcus, Streptococcus, E. coli, all thriving in the damp fibers, waiting to be pressed against broken skin and open mucous membranes. Vaginal infections were so common, they were considered a normal part of womanhood. The itching, the burning, the foul-smelling discharge, these were not medical conditions to be treated. They were simply endured. And because women rarely spoke openly about these issues, there was no collective knowledge, no shared solutions. Each woman suffered in silence, believing her body was uniquely cursed. But the rags were only part of the problem. The real issue was the skin itself. Medieval medicine taught that bathing was dangerous. Physicians believed that water opened the pores and allowed disease-carrying miasma to enter the body. Hot baths were thought to weaken the organs. Cold baths were believed to cause paralysis. The advice given to women, especially after childbirth, was simple. Do not bathe. Do not wash. Let the body heal on its own. And so they did not. For weeks, sometimes months, a woman's body was left unwashed. Blood dried on the inner thighs. Sweat and dead skin cells accumulated in folds and creases. The result was what modern dermatologists would call a biofilm, a thick, sticky layer of organic material that coated the skin and provided a perfect habitat for bacteria, fungi, and parasites. And the smell. There was always the smell. Not the clean, salty scent of fresh sweat, but something heavier. Sour, rancid, laced with the unmistakable odor of infection. This was called the fever stink. And it was so common that it became a diagnostic tool. If a woman smelled like decay, the midwives knew she was infected. But by the time the smell was detectable, the infection was already systemic. And most of the time, it was already too late. The numbers tell the story that the songs and paintings never did. 1 in 3 women died during their childbearing years, not from old age, not from disease, but from the simple act of reproduction. Pregnancy, labor, and the months that followed were the leading cause of death for women between the ages of 15 and 40. If you made it through one birth, you faced the same odds with the next, and the next, and the next. Some women gave birth 8, 10, 12 times. Each pregnancy was a roll of the dice. Each labor was a biological lottery where the house always had the advantage. The babies fared no better. 50% did not survive their first year. Half. That is not a tragedy. That is a system designed to fail. Infants died from infections passed through contaminated breast milk. They died from exposure to the same filth-covered rags their mothers used. They died because the straw they were laid on was crawling with parasites. They died from tetanus contracted through the umbilical stump, cut with a blade that had been used to slaughter chickens hours before. Dr. Bartholomew of England, writing in the late 1200s, recorded that most infants who survived birth died within the first 40 days. He did not know why, we do. They were being poisoned by their environment from the moment they drew breath. And yet, some survived. That is the mystery no statistic can explain. Some women gave birth in that straw, bled into those rags, endured the fever and the filth, and lived. Some infants fought off the infections, outlasted the parasites, and grew into children. How? The answer lies in something we have lost in the modern world: brutal, unforgiving natural selection. The women who survived were not lucky. They were biologically resistant. Their immune systems had been battered by a lifetime of exposure to pathogens. Contaminated water, spoiled food, open wounds treated with dirt and spit. By the time they reached childbearing age, their bodies had developed a level of immunological memory that we cannot replicate today. They did not survive because of medieval medicine, they survived in spite of it. But survival came at a cost that we, in our sterile hospitals and climate-controlled homes, can no longer comprehend. And that cost demands recognition. So what separates that woman on the straw from the woman in a hospital bed today? Two things: knowledge and soap. That is it. The biology of childbirth has not changed. The risks have not disappeared. What changed is that we finally understood what was killing them. Dr. Ignaz Semmelweis proved in 1847 that hand washing alone could reduce maternal mortality by 90%. 90%. A basin of clean water and soap eliminated what centuries of prayer could not. The woman lying in that straw was not weak. She was not cursed. She was fighting a war against an invisible enemy with no weapons, no knowledge, and no support. And millions lost. But the ones who survived built the foundation for every generation that came after. Their resilience is written into your DNA. Their suffering bought you the comfort of a sterile delivery room, antibiotics, and the expectation that childbirth will not kill you. Do not take that for granted. If this gave you a new respect for what women endured, hit that subscribe button. This channel exists because you refuse to accept sanitized history. Drop a comment and tell me what brutal historical reality we should investigate next. Your voice shapes the cases I open. And if you think this story deserves to reach more people, smash that like button. The algorithm only amplifies what you tell it matters.